Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership and Business Podcast, where urologic professionals experience the practical application of business acumen essential to successfully navigating today's rapidly changing business environment. I am Dr. Micheal Darson, and in today's episode, we will discuss negotiating a hospital employment contract. Joining me today for the discussion is Dr. Ken Berger. Dr. Berger is a hospital-employed urologist at Tri-State Memorial Hospital in Washington State, where he is the chief of surgery. He is the chair of the AUA Leadership and Business Education Committee, president of the Washington State Urologic Society, and lead urologist for Washington State University Medical School. He is also a former attorney. I would just like to add that nothing discussed here today should be considered legal advice, and always consider hiring or consulting an attorney before signing any contracts. So welcome, Dr. Berger. How are you today?
Doing great. Thanks for having me.
Well, let's go ahead and get started. What is contained in a hospital employment contract, and what are the elements of a hospital employed contract?
So a hospital employment contract generally has standardized clauses, which may be different from contract to contract, but they're usually similar. And it usually starts off with a clause on background, recitals, and definitions. And this helps define the term contained in the contract, any abbreviations, and the parties to the contract. So it's important to really read that as you're going through a contract so you know the terminology within the rest of the contract. There's usually an obligations clause, which helps describe what each party is obliged to do. So that might describe your responsibilities as a physician for the hospital. It might talk about what your call coverage is, your standing, your licenses, your board certification, and it also describes what the hospital is obligated to do to you or for you. There's usually a clause in compensation. Some contracts will have compensation embedded in that clause, but most contracts seem to add it as an addendum or a rider to the contract. So it may refer to something that comes later. There's usually a representation and warranties section, and that may include a clause on sanctions. Basically, this warranties that you are free to practice medicine in your state and requires you to notify the hospital if you have any sanctions against you. And it's important to look at that because that may be different from contract to contract. There's always a section on the term of the contract and how to terminate the contract. And again, that's something that's important to know. You want to know how long you're signing the contract for, and you also want to know what are your obligations and how to get out of the contract if you need to. There's usually a clause that talks about outside business. Most hospital contracts, as a rule, will prevent you from having any outside business interests other than your obligation to the hospital, and that's generally something that can be negotiated. A lot of hospitals, although not all, will put in a non-compete clause, and that's something that varies from state to state and jurisdiction to jurisdiction. It may or may not be legal in your area, and that's a subject of negotiation as well. And then the last part of the contract usually talks about if there are any conflicts in the contract and it needs to be disputed, how is that done? What state laws are followed? And will that be by mediation or through the courts? And that's something to look at as well.
Okay, I see that there are several terms in here that are obviously more legal terms. Are there any obvious areas where you need to pay more attention to reading through the contract versus, parts where some of the terminology you're more familiar with?
So, a good contract should be written in fairly plain language that's easy to read. And if you can't understand it, that's a problem and a red flag right there. Again, if there are questions as to a contract, I always recommend consulting an attorney. But most contracts you should be able to understand by reading through it. They should be in fairly simple language. The most complicated part of the contract is usually the compensation part. I think that's often the hardest to understand. And that's also why it's often outside the contract as an addendum or a rider. That also gives the hospital more opportunity to change that if they need to. I think other areas that are really important to look at are your obligations under the contract. And again, it should be in fairly plain language, but you really have to look at that because it explains what they expect of you. And it's also the place to put in what you expect of them, whether there's certain staffing requirements that you need, whether there's certain equipment you need. All of that stuff can go in there. The other things to look at are clauses on vacation time, CME time, and how that accrues.
Okay. So I like the reference to the contract should be in fairly plain language that's pretty easy to understand. It sounds like that's kind of one of those landmark things that you can depend on. And if you're not understanding your contract, like you said, that should be a red flag. So I think that's especially probably going to, yeah, it's going to be especially important for the folks coming out of residency. And let me ask you a couple other questions about this. So when you say the outside business interests are fairly limited from a hospital employee contract, and I think we're going to cover some of this maybe a little bit later.
Yeah.
But how do you decide, all these ancillary revenue streams that you would be missing out on as a hospital employed physician? Is that where you're going to start factoring in, like, know your worth type?
So, yeah, as a rule, I've actually never seen a hospital employment contract that allows you to conduct outside business and earn money outside of what they pay you. And that's definitely something that can be negotiated. So if you know that you were going to have an interest in a lithotripsy company or some other company where you may be earning income on the side, that really has to be set out in advance. In my instance, I am also an employee of Washington State University, and I negotiated that with the hospital before I signed a contract.
And as far as kind of knowing what to ask for, particularly for the folks coming out of residency, how would you counsel them to find out, like, what they think they need?
So that's probably the best question. And there's a couple parts to that answer. The first thing is you need to do your research. If you know people that work for the hospital or you have colleagues that you're going to be working with, speak with them. Does the hospital have a reputation of treating their employees fairly? You should be able to easily find out what other people in the hospital are earning. Do they earn the same thing for doing the same job, or are different people on different pay scales? That's something that may be a little bit more difficult to find out, but again, it's always worth asking the questions. The other thing that you always have to ask yourself is, how badly do you want the job? If you are dead set on being in a specific location or at a specific hospital, then I think your negotiation strategy is very different than if you could go various different places in different locations, and that one particular location isn't as important to you as getting the right job. Then you have a lot more leeway in what you ask for.
Okay. So regarding the non-compete, and I know this can get very complicated, what's your best advice on how to interpret the non-compete clause? And I'm asking that from the background of different states are going to have different ways that they approach a non-compete.
Absolutely.
So is it something that you would refer to how does one investigate that?
Again, the best thing would be to ask an attorney in your area. Now, this is the problem with non-competes, and there's also a lot of talk now about the federal government doing away with non-competes across the board, including in the medical area. And there's a lot of controversy about that, including from physicians who employ other physicians in private practices and The thing about non-competes is that whether they're legal or illegal in your jurisdiction, it can still be a pain to you and cost you a lot of money. Even if they're not legal, if the hospital wants to try to enforce it, they can cause you to hire an attorney, which will cost you a lot of time and money before you eventually get it settled, even if it's illegal. So it's really important to try to get that straightened out ahead of time. I mean, I would encourage everybody to see if you can get out of a non-compete before you start. But if you do start, really look at the breadth of it. They're all very, very different. And some non-competes will say you can't work within a 20-mile area of the hospital. Some will say you can't work within 20 miles of any clinic that we have throughout the state. And that's a very, very different thing. It's really important to look at that, especially if you're at a place and you know that you want to be there and stay in that community, even if it doesn't work out with the hospital.
Right. Yeah, it's interesting. I've always found non-competes to be kind of a complication that doesn't need to be there, because it really typically only protects one side. And it's interesting that even state to state, how it varies. For instance, in Arizona, if a judge finds a non-compete is not enforceable, you can't take a red line and go through and just correct that portion of it. The entire non-compete is unenforceable.
Mm-hmm.
But I know not every state is like that. So it's always, I think, in your best interest to, like you say, find it. So would that be like an employment attorney that they would seek out?
It would be an employment attorney.
Okay.
Yeah.
So yeah, that would be probably, especially again, for the folks just getting out of residency, probably a really good idea to bounce that non-compete language off an attorney.
And there are actually employment attorneys that specialize in healthcare contracts who work with hospital contracts. And the best way to find them is usually to ask a colleague where you're planning to go. Most people have used one and will have a recommendation for you.
Okay. Well, great start. Let's move on to contract review and preparation. How should one prepare for negotiations?
So again, this is where you really want to do your research. The first thing is, I think you need to know your own value. What is the average salary for what you're going to do in your area? And that might be different if you're working for a private hospital versus a public hospital versus an academic hospital. But you need to know what the average is. The whole goal of a contract is for both sides to benefit. Nobody really should come out feeling like I gotcha. It really has to be a beneficial agreement to everybody. And that's the goal. It shouldn't be unreasonable. You shouldn't ask for more than you're worth, but you shouldn't receive less than you're worth either. And those numbers should be fairly easy to figure out. And you can also ask the people who work at the hospital that you plan to go to.
Okay. Again, so knowing your value, what kind of advice would you give to the folks? And I think some of this is going to be a repeat, but to the folks that are coming out of residency that don't really understand different revenue streams. I mean, is it talk to the people that are there?
So, again, every hospital is a little bit different. So I can tell you the last hospital I was at, they really wanted to cap physicians at a certain income, but they were willing to give more money, but for doing other things. So for supervising for mid-levels or APPs, they would pay more. They would pay for being chief of a service. Other hospitals don't want to pay for those things, and they'd rather pay you more up front. There's so many ways compensation can be determined. Some hospitals, it's eat what you kill. Some give you a generous base salary with a bonus structure. Whatever it is, you need to know it ahead of time and be comfortable with it. There shouldn't be any surprises once you sign a contract.
And I would also add that to our listeners, the AUA and this whole podcast series has a tremendous amount of information to help you understand what you're worth, especially, again, going back to folks that are just getting out of residency or perhaps changing from, an academic environment to private practice or vice versa. Knowing the business side can only help you understand exactly what you're worth, and that's obviously important because the downstream effect of that is you're going to be happier if you negotiate your contract to the best of your ability to make you feel like you're valued and that you're getting paid what you're worth. So that's really important stuff there for sure.
The other thing that we should probably mention here is in terms of compensation, another part of the contract, especially if you're coming right out of residency, is usually things like moving expenses. A lot of contracts will have loan forgiveness, and some will front you money or give you a signing bonus. Most of those things are often proposed as loans, which are then forgiven over time. And those it looks funny in a contract when it's presented as a loan, but as long as you stay in there for a certain number of years, a certain portion is written off every year. And that will also leave you with tax liability for that money. So that's something to think about too.
Oh, that's a really good point. So let me ask you, what advice would you give to someone who, say they're coming out of residency, they know that they want to go to, this part of Washington, and they're more limited on, what they can ask for. What do you think are the most important things to focus on? If they can't have everything, what are the things that are typically most important?
So I think the things that are probably most important are, one, again, you want to feel like you're being fairly compensated for what you do. So your compensation should be in line with other people at the hospital and the area that you're living in. Aside from that, usually most hospitals will have a specific amount of vacation time that they give most employees. A lot that's negotiable. And again, you don't know unless you ask. The other things are CME time and money. That's often negotiable. Whether you're going to have an advanced practice provider as part of your practice, usually negotiable. Your work hours, something you should, make sure that you have out ahead of time. Some contracts are 5 days a week, some are 4 days a week, some are 4.5 days a week. Are you going to be working a full 5-day week or not?
Okay. And those are all negotiable then?
Those are all negotiable. I mean, in a true contract, anything is negotiable. Of course, okay. Most hospitals would prefer to have standardized contracts because it makes it much easier to keep track of their employees, as opposed to everybody having something completely different that they have to keep track of. But a lot of these things are negotiable. Not everywhere, but again, doesn't hurt to ask. Especially if it's important to you.
Yeah, that leads us pretty smoothly to the next point. Understanding what you should and should not ask for in negotiations. I mean, how do you know and understand what you should ask for in negotiations?
Again, the best way is to do your research and talk to other people. If you get a sense that the hospital treats their employees fairly, then you have a sense that when they suggest something, that's probably what they're doing for everybody. If you get a sense of otherwise, again, that should be a red flag, but it never hurts to ask as long as it's done in a respectful and politeful way. Also, if you don't want to be in that position of asking, that's another good use of an attorney. They can ask for you, and then it comes from them and not you, and puts a buffer between you and the hospital. How do you know what to ask for? Again, if you're dead set on one specific place, I think that most people would be a little bit more cautious in what they ask for. But if you're not dead set on the place and you're just looking for the best deal, there's no reason to really not ask for anything that you want. They can say yes or no. At the last hospital I was at before I came to where I am, I had already really decided that I was going to leave. But before I left, I asked for a lot of stuff just to see what they would do. And I was actually surprised at some of the things that they were willing to negotiate on. And I was surprised at some of the things they weren't. So it's interesting. It can never hurt to ask as long as it's done in a respectful way.
So yeah, I was just going to say it sounds like a important theme of this is if you don't ask, you're never going to get it right. So
exactly. It's really important to remember that if you're going somewhere, you want them to want you, and you want them, and you want to want them. It needs to be a mutually beneficial relationship. And if it's not, it's probably not going to work out. Both sides need to feel like they're getting benefit from the deal and the negotiations.
So what would you advise somebody that say they've done their best to negotiate their contract, but a year into a 2 or 3 year deal, they've stumbled on things that they didn't know and that they feel that are unfair or should be altered. What's the strategy, or what advice would you give somebody that has signed a contract but now is learning all the stuff that they didn't know, and they find that they feel like it's an unfair contract?
I've been in that situation before, actually. And the first thing to do is talk. I'll always talk and ask before you take it further. I was lucky enough that at one of my prior positions, things had changed, and I brought it up to the hospital, and they agreed with me, and we changed the contract. We actually renegotiated it before the term was up. I don't think that would be most people's experience at other places, but again, that's the first place to start, by talking, bringing up your concerns. Hospitals really do invest a lot of time and effort in you, and we invest a lot of time and effort in them. It's really in nobody's interest for someone who's doing a good job to leave if there's ways that they can work it out.
So it sounds like that's really good advice, because I think, at least I've certainly heard of stories where people just continue to take kind of the short end of the stick, in their opinion, and then they become resentful, and communication either slows down or stops completely, and then it ends poorly for both sides. So I think the advice to open up a respectful line of communication is a really good starting point.
Always do that before taking legal action, writing letters. Talking is always the best way to start. And then things can go from there. I mean, there's really no reason that anybody today should be resentful of their contract unless they're really tied to one hospital, one area, because there's so many jobs out there.
Okay. So what would you say in general, when do you know you should be seeking legal counsel? I mean, what are is it just you don't understand part of it, you got to have a professional kind of decipher it for you, or are there other red flags that you would say, look for this, and if you see something like this, you probably need to get an attorney? What's some general advice in that regard?
Well, first of all, I would always recommend, especially if this is the first time you're signing a contract, to get an attorney to have them walk you through it. Even if the language seems pretty plain and you feel like you understand it, sometimes things can have unintended consequences, and it's always good to have somebody with knowledge to walk you through it. Other than that, if you don't understand the language of a contract, that's a red flag right there. Have somebody walk you through it. If you've heard from other people through the grapevine that the organization that you're planning to join doesn't always treat people how you'd like, but you still want to be there, have a lawyer look at it. There are places out there where people do get different contracts for doing the same thing, and you may have more room for negotiation. That would be another good place for a lawyer. If you feel like you just don't want to be that person asking for stuff, again, a lawyer is a great buffer to go between you and the hospital.
Okay. What about, do you have some, I guess, war stories about contracts that you've heard of that have been a problem, have been really unfair? What are some potential?
So it's not that I think, again, is any contract that someone signs truly unfair? I mean, it's all about knowing what you're signing ahead of time. But I've seen contracts that require people to cover 4 or 5 different hospitals. The hospital has the right to move them around to whatever facility they feel like at their discretion. I've seen contracts that are hospital employed where people are just earning eat what you kill rather than having a base salary. I mean, I've seen a lot. I think you have to pay very close attention to signing bonuses and loan forgiveness to understand what your responsibility would be if you decide to leave before the term of the payback. Because that can be a substantial amount of money that would prevent you from leaving for quite a while.
Okay. What about
the other thing is healthcare contracts or hospital employed contracts in a lot of ways aren't really a true contract. Even though you sign a contract for a term, 3 years, 5 years, 2 years, whatever you want, these contracts usually have outs for both sides, usually for cause within 30 days and without cause with 90 days, which means that other than any monetary obligations you might have due to bonuses or loan forgiveness, you can usually get out of them fairly quickly, but so can the hospital. I've had facilities in the past use that to try to renegotiate the contract.
Interesting. So what would happen to in an employed physician contract where how does the accounts receivable get handled? Like once the one party or the contract ends, how does that typically work?
So that's really different than private practice. So, again, it depends how your contract is structured. And some hospitals may put that into the contract as part of your compensation. For the most part, most hospital contracts, especially if you're receiving a base salary, they own the accounts receivable. So you would just get your salary through your termination date and they keep the rest.
Okay.
I mean, if they own you a bonus over that, you may get that portion of the bonus later.
Okay. Are there different ways that malpractice insurance is handled in the employed physician setting?
So all employment contracts that I have seen, and again, they can be structured however you want, the hospital covers the medical malpractice insurance. Now, the difference, though, is not all of them will cover your tail. Most of them will, but that's something, again, that's very important to look at when you sign a contract. If you decide to leave, will they cover the tail?
Well, that sounds like a reason in and of itself to consult an attorney.
Yeah.
Because I mean, that can be very expensive and kind of hit you out of left field when you're not expecting it. So
right. So again, for anybody who's listening that's not sure what a tail is, it's insurance that covers the period from the time you leave a practice for 7 years or whatever the malpractice amount of time is in your jurisdiction. It's usually about 7 years. If there are any lawsuits during that time, those are covered by the tail. And that can be quite expensive. It can be, tens of thousands of dollars.
Yeah, that's actually a really good idea to define that. So that's basically that tail coverage covers any case that would be brought against you after you left, but was from a patient that you happened to be a part of their care.
Correct.
When you were employed. So
right.
It's really important for people to definitely understand that. So, all right, you want to summarize with some key points or?
Sure. So let's see. Okay. So I think the first thing really is you have to understand the language of your contract. And again, a good contract would ideally be in English that you can understand. If you can't understand it, get a lawyer. You need to understand your needs. Does the contract provide what you need? Going into a negotiation, understanding what you want and what you're willing to accept is very, very important. You have to know your employer. You have to understand how they treat their other employees and how their negotiations have gone with other employees in the past. You need to know what's fair for the area that you're going to. You don't want to accept anything less than what's fair, but you also don't want to ask for things that are unreasonable or outrageous. It's really important to know what your obligations are under the contract and to know how to terminate a contract and get out of it if you feel like you need to. It's important to know what your compensation is and the compensation model. And that can be very, very tricky. And we're not going to get into the details of that today, but that's something that you really need to look at and understand before you sign a contract. Again, if there's any advances to you or loan forgiveness, signing bonuses, you need to understand what your obligation is for those. And if you were to decide to leave, what your responsibility would be. You also need to understand the tax benefits of getting those. You should understand everything in the contract before you sign it. There should be no surprises afterwards.
Okay. Yeah, all really good advice. I mean, I think the more that we talk, the more that especially first-time contract signers really need to walk through really every element of the contract so that they fully understand it, because there are so many nuances to the same thing, nuances to malpractice. I mean, is the tail covered? Is it not covered? Also importantly, and what I'm hearing from you is there's the contract and then there's the compensation, which is typically outside of the contract. Is that correct?
It's a lot of the contracts basically reference your compensation and then refer to an appendix that gets attached to the contract. And so it's not actually within the contract itself.
Okay. And that should not be a red flag to anybody.
That's not a red flag.
Okay.
You do need to understand it though.
Okay.
And again, the other thing to understand is that these healthcare employment contracts, they're not set in stone. So even after you sign the contract, the hospital and you have ways to get out of them. And those can be used sometimes for negotiation as well.
Okay. And I think another really important key point that you've identified is it's really important to know your own needs. I mean, what is going to be important for you? I mean, is it you want a set amount of call? You want a 4-day schedule? You want a 5-day schedule? I mean, do you want more vacation? All that stuff is really important. And that's probably, as I see this, the most under anybody's control is knowing what their own needs are and how important it is to define that before you go into the contract.
It is. And I think that when people end up resenting the contracts, it's because they didn't think enough ahead of time to ask themselves those questions. You need to go into it knowing what your needs are. And again, I think this is also where it's important to speak to other people who work for the hospital just to get a sense of what other people have and are doing. So you don't want to be outrageous and out there, and you don't want to ask for things that are too unreasonable, but you know what your needs are.
Well, listen, this has been a very educational podcast. I've learned a lot. Are there any other points that you'd like to make?
I don't think so.
No, you've done a great job. Trust me. I'd like to thank you, Dr. Berger, for sharing your time and expertise with us today. You've been really informative.
Well, thanks. I enjoyed being here.
And thank you to our audience for joining us on the AUA Leadership and Business Podcast.
Invest in your leadership and business skills at AUA 2023 with the new AUA Institute for Leadership and Business track. Join the Institute at the AUA annual meeting in Chicago for an opportunity to grow your leadership and business skills. The new ILB track features 7 courses, offering a combined total of 16 hours of programming that will enhance your business acumen, activate your interest in business and finance, and inspire you to become a leader in your practice and the field. To accommodate the robust schedule of AUA 2023, each of the 7 live courses will be recorded for access on demand after annual meeting. Resident discounts are available. Visit auanet.org/AUA 2023 to learn more and add the ILB track to your registration.